Greetings. Welcome back to the Medical Weight Loss Show. I'm your host, Dr. Andrea Walker, family nurse practitioner, doctor of nursing practice, weight loss specialist, IFBB Pro, and owner of Serenity Health Innovations and Wellness. Today's episode was inspired by a conversation I recently had with someone. She was concerned about starting GLP-1 medications. It was because of things she's been seeing on social media, especially TikTok. So she asked me, she said, Dr. Walker, is it true that people are losing 20 pounds in 1 month? Is that too fast? Is that even safe? And what about muscle loss? What about saggy skin? I've even heard about dental problems. I want to try these medications, but I'm scared. I don't want to look old the way a lot of people look when they lose weight, especially in their face. They look so old and it ages them. So, today, I'm here to tell you that those are legitimate concerns, and I'm going to set the story straight. So, today, I want to separate truth from fear and help you understand how to lose weight the right way. So, sit back, grab you some water, and let's begin because water is your friend. So let's start with the big one. Yes, some people do actually lose 20 pounds in 1 month. But here's the question nobody is asking. What kind of weight are they losing? Because not all weight loss is good weight loss. Your body is made up of fat, muscle, and water. And if weight loss is not managed properly, people can lose muscle, excess water, and yes, even develop unwanted side effects. The goal is not just weight loss. The goal is fat loss while preserving muscle because muscle is your metabolism. Muscle is your strength. Muscle is what gives your body shape. Now, speaking of, let's talk about muscle loss. This is a real thing and it is preventable. I have looked at many celebrities before they admit it, or maybe some still don't admit that they're taking the medicine. But I can tell, wow, they lost a lot of muscle. They have to be on a GLP-1. And unfortunately, whoever their provider was did not instruct them about muscle loss and how to prevent it. As an IFBB pro, someone who is pro protein, who knows how to work out, who knows how to build muscle, as well as I'm well aware how you can lose muscle with weight loss. And it's not just the GLP-1s. Anytime you lose weight, you can lose muscle. But here's the thing. People focus only on the scale. At least many of them do. But I focus on protecting your muscle because when you lose muscle, your metabolism slows down, your body becomes weaker, and weight regain becomes easier. This is why medical supervision matters. I tell people that if you can, I highly advise you to go to a local clinic, to someone who truly cares, someone who's walking the walk, not just talking the talk, but they're not just rushing you in and out, taking your money, and then not explaining anything to you. And while, yes, I even do telemedicine and I provide it in my office, but we spend time with our patients and we talk to them weekly. So that's just kind of a little tip. I highly advise you to get with a clinic, or even if you are doing telemedicine and as your preference, make sure you're with somebody who truly cares, who knows what they're talking about, and who are giving you tips on a regular basis with your weight loss and not just prescribing you the medicine every time it's time for you to refill. And that's it. Patients should be coached on protein intake, resistance training, proper nutrition, and ongoing monitoring because prevention is always easier than correcting it once the damage is done. And so that's why here at Serenity, we reach out to you on a weekly basis. Some of my patients that have been with me longer, we might reach out every 2 weeks or every 3 weeks, but we are always available to all of our patients. And we want to know what's going on. Like I said, you don't want to be with the provider that's just sending you your medicine just for your refill and that's it. And I know you probably think that's super cool, but then when your hair is falling out or you're losing muscle, by then a lot of damage is done and you're like, wow, okay, no one told me this. But that's what I'm here to tell you. Get you a good provider. Now, let's move on to sagging skin. Let's talk about it honestly. Saggy skin can happen, but here's what determines it: how fast the weight is lost. I had someone very dear and near to me. She lost about 85, 90 pounds. She built muscle while she was losing the weight, and she looked fabulous. She did not have any saggy skin. I hear people say this all the time: I'm going to start working out once I lose more weight. No, that is so wrong. That mindset is terrible. Don't wait to start working out. Work out now. Work out when you start. If you've been doing this for a while, go ahead, start working out now. It matters. There are things that make a difference when you're losing weight: your age, your genetics, and how the process is managed when the weight loss is done properly with muscle preservation, with proper nutrition, and with medical supervision. The body will adjust much better. Now, let's talk about dental concerns. I was just talking about this maybe a week or so ago with a colleague, and this is something many people don't talk about at all. I'm glad the person I was talking to brought it up just this week. Dental issues can occur for several reasons: poor nutrition, dehydration, vomiting, vitamin deficiencies. So, this is why follow up matters. This is why education matters. This is why supervision matters. Again, I have telehealth patients, so I'm not knocking telehealth, at least not all of them. But just be careful. Sometimes you get what you pay for. You may want to go to the quickest and the cheapest, but then if no one's really following up on you, you're probably going to end up with some of these concerns after the fact. Now, here's the real problem, as I've alluded to: it's the lack of proper medical guidance. Here is the truth: most complications happen when people are not properly monitored, when they are given medicine but not given education, when they are prescribed something but not followed closely. You need to be coached, monitored, and followed up weekly or at least bi weekly. Even if the patients don't come into my office, I still make it a point for either myself or my staff to follow up, because the goal is not fast weight loss. My goal for my patients is healthy, sustainable, and safe weight loss. Now, let's talk about social media. There is all sorts of things being said on social media, and usually when I talk to a patient, I'll try to ask, how much do you know about this medication? Many times they'll say, oh, just what I saw on TikTok or what I saw on social media. And some will say, no, I did my true research. And I'll tell them, well, a lot of what you're seeing on social media is true, but it's not the best thing. Like, yes, there are people losing 20, 25 pounds in 1 month. And I do get people to come into the office, or more so, not really come into the office, but more so on telehealth. And they'll say, well, my friend has lost way more weight than I have. And I go ahead and I explain why fast weight loss is not the answer, is not the key. You may like it initially, but in the end, that is not the way you want to do it. So let's talk about social media. It does not show you the full story. It shows you sometimes before and after pictures, but not the muscle loss. It shows you the number on the scale, but not the health behind it. As a medical provider, My responsibility is to protect my patients, not just help them lose weight, but help them lose weight safely. If you are on a weight loss journey or thinking about starting one, please hear this. Weight loss is not a race, it is a process, and the right provider will guide you, educate you, monitor you, and protect your health along the way. So, in closing, I hope that you will find a licensed healthcare provider either locally or there are some that you can find that provide telehealth visits that are just as good. But make sure you feel comfortable with the provider and they are answering your questions and spending time with you. Thank you for joining me today on the Medical Weight Loss Show. If this episode helped you, share it with someone who needs to hear the truth about medical weight loss. And if you're looking for safe medical supervised weight loss and you live in the states of Florida, Arizona, or Tennessee, feel free to reach out to me. And don't forget to meal prep, work out, drink your water. I'm Dr. Andrea Walker, family nurse practitioner, DNP. Have a great week, and I'll see you next time.